Good morning, guys. Tony Maritato here, licensed physical therapist. And in the following video clip, so what I'm doing is I'm sharing a recording from my physical therapy clinic of a patient who is in physical therapy for the first time following their total knee replacement. Now, these are the first exercises that I usually give somebody to build confidence that they can get back to walking. This was an individual who was doing really great. They didn't have to do the normal heel slides and ankle pumps. They were way ahead of schedule. I believe this was about 2 to 3 days post-op. But they came in with a forward wheel walker. You don't see it in the video clips, but it's there in the clinic. And they were just ready to go. Hang out, stay tuned, watch these. You can hear my instructions. And if you have questions, absolutely talk to your physical therapist because everybody's going to be different. And you want to make sure that you're being prescribed an exercise program that's appropriate for your level. Holding onto the kitchen counter sink, I'm going to ask you to put the surgical foot back. And all you're going to do is you're going to shift your weight forward and backward. You're not going to step. You're just shifting back, shifting forward, like just like that. We'll do it about 20 times with the right leg back. We'll do 20 with the left leg back. So now turn toward me. Your left hand will be on the sink. And what you're going to do at home is your non-surgical leg is going to step forward and step back. Yep. Just like that. Perfect.
And does this bend or anything? Or just
whatever is comfortable for you. The main thing is you're standing with your non-surgical leg closest to the counter. You're holding on for support. You're going to step through about 10 times. Then we'll turn around and we'll do the same thing with the surgical leg stepping through.
I can feel this.
Yeah. And then when you're ready, this side is easier. Yeah.
Yes.
Yep. Perfect. And then back.
Like this?
Yep. You got it. Now, right now, you've got kind of a wide distance between your feet, which is totally fine. But as you kind of get comfortable, you'll step a little closer, almost like you're stepping on a tightrope. There you go.
Do I stop in the middle?
Nope. I would just go from there all the way back, all the way forward. There you go. Okay, so now turn toward the counter so your back is toward me. So we're starting with the surgical side away from the support.
Okay.
And I'm just going to ask you to walk. Walk the length of that counter. You can keep your left hand on there the whole time. Yep. Perfect. So let's say this counter is about 10 feet long. When you get to the end, you're not going to turn around. You're going to walk backward, back toward me. Perfect.